Dr. Glick, do you think there are any new treatments for pain that PAINWeek attendees and their patients should be looking forward to?
As a matter of fact, Nicole, there is. There's what I call an entire new class of devices that can be very effective with respect to treating pain. Everybody's familiar with the idea of implantable neuromodulation, spinal cord stimulation, peripheral nerve stimulation, things of the sort. But there's a new class of devices now that I refer to as transcutaneous neuromodulation devices, because these are non-invasive wearable technology, if you will, that are focused towards interacting with the nervous system, engaging the nervous system the same way the implantable devices work, but in a non-invasive manner. And their goal is to influence the body's own inhibitory pain mechanisms much the same way as we address those mechanisms with pharmacologic targets. So when you consider like the standard of care for most any pain problem that we have, usually involves medications targeted towards one part of the pathway that might have an effect for this particular pain problem. But the standard of care, and all medications really, they never work 100%. Everything usually has a clinical efficacy of somewhere between 40 and 60% on 40 to 60% of the patients. So if you take this new family of devices, let's say, and use them even in conjunction with standard of care, well, they also work 40, 50, 60% of the time on 40, 50, 60% of the patients. But if you use them together, all of a sudden the net outcome is much better than either one of them may have been on their own, so that's cumulative. But these devices themselves can also be used individually. And one of the things that's remarkable about them is they're generally safe. They don't have a side effect profile. There's no adverse events. I think the worst we've ever seen might have been irritation at an electrode site because you're sticking on an electrode. But frankly, I haven't even come across that. So some of the devices in this field are Quell, which is indicated for fibromyalgia. It's a device that you wear on your leg, so you're essentially accessing the sciatic nerve components, peroneal tibial and sural nerves, to engage the nervous system. And while its official indication is for fibromyalgia, we've used it off-label per se for a variety of different musculoskeletal pain pathologies, and we've even used it for post-stroke or post-surgical rehab with remarkable outcomes. There are several devices that are now indicated for migraine, Nerivio, Cephalay, and Relivion. Each one has a slightly different take. The Nerivio device goes on your arm, so that's accessing technically the brachial plexus. Cephalay goes on your forehead, so you're addressing the trigeminal nerve. Relivion addresses not only the trigeminal nerve, but also the occipital nerve. For direct engagement to the nervous system, again, to activate your body's own inhibitory pathways for dealing with pain. There is a device called Livia, which is used for menstrual cramps. I think they have a new one coming to market soon. There's a device for sinus pain called ClearUp. A Sparrow Ascent, which is the device that you wear on your ear, which is used for opioid withdrawal symptoms. Nidra is coming to market now to treat restless leg. That's also using stimulation on your leg. GammaCore uses vagal nerve stimulation, not only for headaches such as migraine, cluster, and hemicrania, but they used it for COVID patients, and now it's got a breakthrough designation for PTSD. But I can see really a broad application for that as well when you think about the fact that you're stimulating the autonomic nervous system. There's an old favorite, and we never really thought of it in this light before, but there's a device, and they're here at PAINWeek as well, called AlphaStim. And AlphaStim's been on the market for about 20 years, but now when you're putting it into this new class of devices called transcutaneous neuromodulation, you're going to look at it in a whole new light, because that essentially goes on your ears, so you're doing transcranial stimulation. So whether you're thinking about these devices individually or to supplement standard of care, I think the door is going to be wide open for helping our patients without this worry of side effects or contraindications or really affecting other comorbidities. I think the future is bright for these devices, and some of them are here at PAINWeek, and we hope others will join us at least for next year.